All right. Hello. Okay. Hi, okay. Hello. My name is Andrea, and I'll be your nurse today, okay? Today we will be conducting a physical health assessment on you, and it should take about 10 to 20 minutes at the most. And if you have any questions, you can feel free to stop me at any time. And I'll make sure and assure you of complete confidentiality, and I'll make sure that your privacy is full. Nothing will leave outside of this room, okay? I'm gonna go wash my hands. Try to keep down all the germs.
Yes, ma'am.
All right, wash my hands. I'll put on me some gloves, okay? All right. All right. I'll start by assessing your mental status, okay?
Yes.
Could you tell me your name and date of birth?
Maloney Harris, 4/13/76.
All right. Great. Okay. I'll name all 4 words, and throughout the assessment, I'll have you repeat them back to me. Okay. And those 4 words will be red, blue, dog, cat. Okay.
Yes.
So whenever I ask you to repeat those 4 words back to me, you can just state it back to me. Okay.
Yes.
She has a very calm facial expression. Her mood is pretty calming and pretty welcoming. Her mood and affect is within normal ranges and appropriate for context. Could you read those 4 words back to me?
Red, blue, dog, cat.
Okay, great. Her attention span is within normal ranges. Her recent and memory and remote memory is all within normal ranges. I got her vital signs before we started, and those vital signs are: her blood pressure is 126/82. Her heart rate is 89. Her temperature is 98.9. Her pulse ox is 98%. And do you have any pains today?
I do not.
Okay, she has no complaints of pains, and all those vital signs are within normal ranges. All right, so now I'm going to start with assessing her skin, okay? So I'm just gonna look you over. Make sure you don't have any lesions. Checking her legs. Okay, hold your arms over for me. All right. Pause 1 second. I don't know if I can pause it. Just go ahead and answer. You can go ahead and answer. 1 second.
No, she is that.
Okay, sorry about that. Okay, so we're going to assess her skin. So I'm just looking over your skin. Hold your head up for me. All right. All right, so her skin is within normal ranges. Her skin is appropriate for ethnicity. It's warm, dry, it's intact. She don't have any abrasions. She don't have any lesions. No deep wounds. She has no tattoos. She has no tinting. And tinting basically is you have it, it'll stay up, and that could be a cause of dehydration.
Okay.
Anything of that nature, okay?
Yeah.
She has no dryness. She has no lumps anywhere where we're checking. Okay, so now I will assess your head. Okay.
Yeah.
So I'm gonna just look over it, touch it a little bit. So her head is normal cephalic. Her scalp is free of all sores. It is intact, no lesions, no abrasions. Her hair is pretty short. It's thick. She has a coarse texture hair. It's distributed evenly. It's free of all parasites. Okay, her face is pretty symmetrical. It's even all over her eyes.
Drea,
Yes?
61 on me, what's going on?
Okay. Her head is pretty even. Her eyes are in the upper third of her face. Her nose is, can you pull your mask down for me? Her nose is some midline. Her mouth is in the lower third of her face. Third of her face. Now I'll assess her cranial nerve 5 by having you close your eyes, okay? And I'm going to use, I'll get a napkin. Close your eyes for me. And I'm going to touch different parts of her face and have her repeat it back to me. So whenever I touch your face, you let me know where you feel it, okay?
Okay. Below my eyes.
What side is this?
Below my left eye.
Okay.
Below my right eye.
Okay.
Above my left eye.
Okay.
On the tip of my nose.
Okay.
My chin.
Okay. Okay, her contractions are strong and equal bilaterally. Her facial nerve tech, I'm gonna, nerve 7. Okay, her nerve 7 is intact and all of her facial expressions are symmetrical with no drooping. And she is able to, could you close your eyes for me? And try to like pull up. Like when I pull up, you keep your eye closed. Okay, so she's able to resist me from opening her eyes. Okay, so now I'm gonna assess your nails. All right. Her nails are pretty even and trimmed. Her cap refills are less than 3. She has no clubbing. No cyanosis at all anywhere. I'm gonna check her feet. Okay. Capillary refills in her feet are less than 3 seconds. Okay. So now I'm going to check your eyes, okay?
Okay.
Look in your eyes. Let me get my pen light. Second. Okay. I'm gonna check. Okay. Her eyes are free of drainage and any leakage. She has eyelashes evenly distributed above her upper eyelid and her lower eyelid. Her eyebrows are pretty evenly distributed. They're thick, black, and coarse texture. Ooh, excuse me. If you could follow my finger, I'm going to assess your nerve 2. Okay. This way. Okay. Okay, eyes are intact and full without any nystagmus. Now I'll inspect your pupils. Okay. Okay. Her pupils are intact. They are round, reactive to light, and accommodations. And whenever we use that ophthalmoscope, we're basically checking for retinal detachment and any type of eye diseases, okay?
Okay.
So now we'll go to her ears. And her ears on both sides are pretty much symmetrical. They're even. And they're at the same level as her papillary fissure. Her skin is normal with the rest of her face. It's pretty much even, same color. She has no piercings. They're warm, without any lesions, without any earrings, without any drainage. She has no, do you have any tenderness in your ears?
No, I don't.
Okay. No tenderness. I'm gonna look inside your ear. All right. Ears are intact and I am able, so I'm gonna cover my mouth and I'll whisper something, okay? And you let me know if you can hear what I'm saying. Can you hear me on this side pretty
Yes.
good?
Yes.
Pretty good on this side?
Yes.
Okay, she's able to hear me from both sides, which means your cranial nerve is pretty intact. And the patient can hear from both sides of her ears. Pretty fair. Okay, now I'm going to assess your nose.
Okay.
Okay. Her nose is midline with no deviations. I'm going to assess your frontal. cranial maxillary. Sinus is for tenderness, or have you been having any drainage or extra tenderness?
I haven't.
Okay. So no tenderness. The nerves are patent, and her cranial nerve is intact. Okay. So now we're gonna do your mouth. Okay, sweetheart.
Okay.
So open your mouth for me. Yeah. Looking around. Okay. So her lips are symmetrical. They're pink. They're moist. They are intact. She has no cracking or no lesions on her lips. Her mucosa was pretty pink, moist, and intact. All her teeth are intact, white. Dentation is pretty good. Her tonsils are pink with no swelling. Her uvula is midline and raises and fall. And her tongue was pretty pink, and she has slava presence. And so now we will assess your neck, okay? Just take it, you can pull the mask up over your face. Yeah, I can take it pretty good. Just listen a little bit. Okay, I'm gonna assess your carotid pulses, okay? The skin is dark brown with face, no hair.
What the fuck is happening?
You're fine, no hair, no scars. Her neck is symmetrical. She has full, can you do your neck like this for me? She has full range of motion. She has no palpable crepitus. No nose or palpable. Her carotid pulses are strong and equal with regular rhythm. Let's listen to this. Without roots, and it also helps me just to determine if your arteries are clogged at all. So basically, if you're a root over your carotid arteries, they can help you like diagnose heart disease or any type of malfunctions going on. Okay.
Okay.
So now we're gonna check your thorax and your lungs. Okay.
Okay.
I'm gonna listen to you. All right.
Mm-hmm.
Deep breath for me. All right, and her transverse diameter is pretty 1 to 2. Her spine, sit up for me, is pretty midline with no S shape.
57 IVs going off.
Okay, thank you.
Okay, lung sounds are clear to osculation without any extra sounds. Okay, and that's pretty much going to be the end of our assessment. At this point, I will do a breast assessment on you, and then we'll just be assessing for any lumps. If you didn't have any drainage or discomfort, we do it, but we can't do it. That's not part of our assessment. So,
Okay.
thank you very much.
Yes,
We
ma'am.
are complete with this body assessment. Thank you. Signing